All right, we'll see what happens with that. More than 500,000 people end up in the ER every year because of kidney stones, and that number just continues to rise. Our own Dr. Kevin Campbell just went through this himself.
I did.
Doc, how are you feeling?
I'm much better.
Yeah?
You know, it's one of those things that you never want to do more than once if you can help it.
No doubt about that. How long were you out? You were out a couple of weeks, right?
Well, the kidney stone itself took about 4 days to go on and pass, and you know, it takes a lot out of you, so I was a little slow for a week after that.
Right, but you're feeling better now.
I'm feeling better now.
All right, let's break it down. What exactly is a kidney stone?
So kidney stones are minerals and salts that normally are processed in the kidney. If you become very dehydrated and the urine becomes very concentrated, they can actually stick together and form pebbles or grains of that salt that then pass from the kidney down through the tube called the ureter into your bladder, and that's what the pain and discomfort comes from.
And then you get to a point where you have to pass it, because if they do detect it earlier, there is a process that you don't have to physically pass it, right?
If you're someone who gets lots of kidney stones, they may do an imaging study called a CT scan or a CAT scan, and if they see stones way up in the kidney, they can do something to break those stones up so they'll pass on their own. A lot of stones do pass on their own. Believe it or not, kidney stones are increasing in frequency in the U.S. It used to be less than 5% of people. Now, the peak time to get it is in your 30s and 40s, and I'm in my early 40s,
right.
So I hit it right on the head.
Why? What causes them?
One of the most important things to remember is dehydration. I've had kidney stones twice, and both times I had been operating all day, not eating and drinking a little bit of coffee, and then that causes dehydration, which causes the stones to form. Because normally the urine can dilute those stones, and they'll pass and you won't know anything about them.
What else can we do to prevent them?
I think one of the smartest things to do is reduce the amount of animal protein you eat.
Right.
If you have a stone, have your doctor analyze that stone in the lab, because he can tell you what kind it is. There's several different kinds, and based on that kind, they know how to treat it and prevent it. But prevention is key, because you don't want to go through this if you can help it.
Animal protein. So I had ribs and steak yesterday. Not good, huh?
It's not, and I love steaks
ribs
too.
and steak together.
It's hard to avoid, but more fish, more Mediterranean type diet, just like for heart disease, can also help prevent kidney stones.
Doc, good to see you.
Good to see you, sir.
Glad you're doing well. Of course,
Thank you.
If you have a question for Dr. Kevin Campbell, really easy. Log on to our website, WNCN.com, search links we mentioned. From there, you can find Dr. Campbell's website, or you can like his Facebook page, and you can also ask him questions on Twitter.